Okay, we're here with Nurse Jazmyn, and Jazmyn is going to be performing one of our most popular treatments. It's a microneedling treatment using the skin pen microneedling device. Currently she's spreading a little like hyaluronic acid gel. This is just something that provides a little slip and slide on the surface of the skin. Our patient's skin has already previously been numbed. She's had some topical numbing cream on for approximately 30 to 45 minutes. That's all been wiped off and cleansed prior to us beginning this video. So right now, that's the sound this little pen makes. It's got 11 little reciprocating needles that bounce up and down and kind of tickle, if you will, the surface of the skin. So there, she's just going to maintain a kind of a perpendicular aspect with the pen to the skin and slowly moving back and forth. We're going to develop some little punctile points where there'll be a little bit of spot bleeding, and that's actually very healthy. Originally this treatment was referred to as collagen induction therapy because that's essentially what the point of this treatment is. It's controlled injury to the skin, physical injury to the skin that causes the body to produce more collagen. How's that feel, Judy? Tickles? Kind of annoying? Not too bad? So an entire treatment takes about 20 minutes to completely treat her face. And like I said, don't be surprised if you see some mild bleeding. Some people can even, if they're real thin skin, can even get a little small minor bruise that'll last a day or two after the treatment. So we're just making small little circles just to kind of really adequately cover this quadrant of her forehead. And then Nurse Jazmyn is going to move down after she completes the forehead. She'll do Judy's nose, then her upper lip and chin, and I think she's going to save the cheeks for last. I would say the forehead is probably one of the least comfortable places. Any place you have a little more padding and fleshiness is a little easier to tolerate this treatment. We have the ability to adjust the depths of the needles, so if the patients want minimal downtime, we can give them more of just kind of a glowy facial microneedling, if you will. And if somebody wants to be really aggressive, we can dial up the depth, get more pinpoint bleeding, even to the point where you've heard this sometimes referred to as even a vampire facial. That's because an aggressive treatment like this really does leave the face temporarily bloody until the end when you wipe it off. One of the special treats that we've reserved for Judy, and that you saw us earlier in the video preparing, was platelet-rich plasma, or PRP. And the platelet-rich plasma is going to be applied at the end of the treatment in order to speed her healing, as well as potentially and arguably produce more collagen in her skin. So this is a great treatment for people, believe it or not, with pigmentation. For some reason, this actually does improve superficial pigmentation. Great for fine lines, wrinkles, and pores. This is also a great treatment. We have many patients that have mild acne scars that do a series of 4 to 6 treatments to improve the appearance of their acne scars. Beyond microneedling, of course, if your skin is an appropriate type, you can do laser work to improve microneedling's results. But this is a really good starting point for many, many patients. So, got a little bit of bleeding there with Judy. Real nice job. Jazmyn's taking her time. It's really important for the patient comfort that they kind of trust their provider and that they know that the provider is going to kind of move slowly and check in with them. Judy, you look really comfortable. You are? That's good. I think you're getting kind of just a moderate treatment. You got a little bit of bleeding going on the forehead, but not anything crazy. So here we go on the nose. This can be a little tickly, almost making some patients want to sneeze. Getting the bridge of her nose. And we'll go down. We're going to be checking in later with Nurse Jazmyn when she gets to the larger areas of the face, such as the cheeks. Okay, we're back with you, and Nurse Jazmyn is now focused on treating the patient's cheeks. So we've increased the depth of the needle penetration here, I believe. You're probably at 2 millimeters, Jazmyn?
Yes.
Approximately? Okay, so we're at 2 millimeters. And so she may get a little more punctile pinpoint bleeding here. Pretty comfortable, Judy, would you say, on the cheeks compared to your forehead?
Yeah, it's comfortable.
It is? Yeah. So we're going to go over, make several passes, and just kind of get her skin to kind of evenly be pink and possibly a little bloody all over. Looks like you've already treated her right hand cheek. So she's nearly done with the treatment, and this treatment has taken us about, so far it looks like 17 minutes. So you can see this is something that can be done pretty easily. If you're not too sensitive about how you look, I would say you can go about your day. Normally you'll just be a little pink after this treatment, after you go home. We do ask that you don't wear makeup, and particularly not sunscreen. Sunscreen has a lot of ingredients that can potentially cause skin irritation and or allergic reactions immediately after microneedling. So we like our patients to use nothing on their skin for 24 hours other than the hyaluronic acid gel that we may send them home with. After 24 hours, pretty much anything goes. You can return to your normal skincare regimen. Right over here on the right of Nurse Jazmyn, there's a tube that came back from the lab, so we've already drawn Judy's blood. And this tube now has a special layer right above the red blood cells, which are in the bottom of the tube. These are the red blood cells once this blood has been centrifuged for about 5 minutes. And then the top portion, that's kind of golden yellow, that's the platelet-rich plasma. So you can see we have about 4 cc's, maybe of 4 or 5 cc's of PRP, platelet-rich plasma, that we're going to plate or spread topically on our skin. If people have severe acne skin or acne scars, which Judy is lucky enough not to have, we'll inject some of that PRP underneath the acne-prone areas to promote the growth of collagen. But I think in Judy's case, we're going to use the PRP just topically. So Jazmyn's carefully treating her under eye area. This skin is thinner. Sometimes the depth of the needle penetration is reduced in this area. Some very delicate skin patients can have mild bruising, like I mentioned earlier, that could last 2 to 3 days in this periocular area. But it looks like Jazmyn's being really careful just to kind of get the skin a little pink, a little mildly bloody, but nothing excruciating for the patient. There we are. Okay, we're going to work a little bit in the crow's feet and the temple area. Crow's feet is an important area to work on in an older patient like me. But we're just looking for just like skin rejuvenation here for Judy. So Jazmyn has a pretty nice light touch right in this area. So that's it. That's as easy as microneedling is. One of the most popular treatments in our office and a favorite of many of our employees. And again, it's just because it has low downtime and kind of easy to go back to work, easy to resume your normal regimen. So we're here just wiping the remaining blood after the microneedling treatment off. We're doing this just so she doesn't frighten anybody when she leaves the office today. A little saline right there on the gauze pad, like Nurse Jazmyn is preparing, helps just soften some of that dried blood. It just depends on how long the microneedling takes, whether the blood kind of dries in place. But we'll get her cleaned up, and then we're going to use the platelet-rich plasma on top as the final step. You'll see that in just a moment. So here's the crowning grace of this treatment. We've got the PRP loaded in a syringe. There's a needle on the end. We only use the needle just for drawing up the PRP out of the vial. But Nurse Jazmyn is going to just drip the PRP on Judy and then spread it with a gloved finger. So here we go. There it is. Just kind of just topically apply this. And we want to make sure that patients don't go home and, of course, rinse this off. So instructions not to rinse your face for several hours after the application of the PRP. We want this to sit in the skin and just penetrate, and give you the maximum benefit. So it's as easy as that. This is an add-on to a regular microneedling treatment when we don't use the PRP. But again, patients who experience PRP this way are unlikely to go back because this really speeds the healing process and some say enhances the collagen production especially in patients that have enough PRP, have enough that we can isolate enough PRP in their blood. Generally, if we're using PRP as a topper for a microneedling treatment, we don't use any other serums, at this point. Thanks for watching. That's it. Microneedling with PRP.